Hi everybody, this is Jack Wilson with Pharmacy Technology Solutions. Today we're going to give a quick overview of the iLocalBox, which is a remote or after-hour pickup locker. It's about the size of a standard vending machine, but it's a modular system, so you could add on additional cells as you see fit for your specific operation. So before we jump into the actual demo, just to give a quick overview of the company. iLocalBox is a privately held company that was founded in 2016, based in Southern California. We're a healthcare and pharmacy focused company and a technology company that's growing extremely fast. Right now we have over 120 iLocalBoxes out in the field today in the United States and Canada. And we're also eager to expand into other countries across the pond as well. The iLocalBox is regulatory compliant and also HIPAA certified. And it's all driven based on our cloud system that integrates with your pharmacy software system. So it's a really streamlined process from loading the iLocalBox to patient pickup. There are many different use cases and markets that the iLocalBox fits very nicely into, from hospitals and health systems to independent pharmacies and everything in between, including large retail chains as well. The iLocalBox can be used again for after-hour pickup when the pharmacy is closed, for employee pickup after hours, and also helping streamline different processes like your meds to beds program. Instructing patients to come down to the iLocalBox to pick up their prescriptions on their way out of the hospital. Or again, in remote pharmacy deserts or remote clinics that don't have easy access to a pharmacy in their area. This photo that we're displaying here is the iLocalBox main unit. It has 46 individual cells, and each cell is one-to-one for a patient. So it could be one prescription, it could be 10 prescriptions, it doesn't matter. It's just one-to-one with any given patient. The screen is also very large and inviting, a very easy to use user interface. So not only does it help again with the stocking process, but the pickup process as well. And the iLocalBox can also be wrapped in your specific brand. So that's something that we could help facilitate, or you could do on your own. Again, very easy process to do so. Down here on the bottom of the screen, we've outlined just a general workflow of where the iLocalBox fits into your regular operation. Everything behind the counter is exactly the same, from filling the prescription to having the pharmacist do the PV2 process. On the back end, there's a stocking process. The customer is then notified that their patient's ready to be picked up. And then there's a simple process for them to scan a QR code and retrieve their medications at the remote iLocalBox. As I mentioned, the iLocalBox is a modular system, so you can add on different units as you see fit, but it starts with either the main or the mini unit. Again, the main has 46 individual cells and it can serve up to or over 600 patients a month, whereas the mini has 22 individual cells and can serve 300 plus patients a month. To give you an idea of some of the different add-ons that you can add to your specific iLocalBox setup, we've got a 36 unit add-on, a cool unit which has 8 individual refrigerated cells. That's something that differentiates the iLocalBox. We're the only system out there that does support refrigerated units. And then there's also a larger add-on, the A60, that has various sized cells and can be added on very easily via USB connection. We'll jump into this a little bit more when we go into the demo, but here's an overview of the cloud system that drives the entire workflow. So depending on your specific requirements, we can collect payment either remotely or directly at the iLocalBox. We can collect signatures from the patient. We can facilitate web consultations. And we can also require a driver's license scan for controlled substance pickup. So a lot of different flexible workflow options that can be enabled in the cloud that I'll show you here momentarily. And lastly, just to call out some of our existing iLocalBox partners, you can see that we're in a lot of different hospitals and health systems, but again, we work a lot with retail independent pharmacies and small and large chains as well. Here are just a couple quick examples of where the iLocalBox can be placed. Cedars-Sinai, one of our customers in Southern California, has an iLocalBox placed right outside of their retail pharmacy or their outpatient pharmacy. So not only can employees pick up their prescriptions after hours, but it can also, again, facilitate their meds to beds processes. You can see on the left-hand side here, this is a cool unit. So 8 individual refrigerated cells, and then they have a main unit here as well. You can see each one is also wrapped to the specific requirements of that given pharmacy operation as well. And then lastly, before we jump into the demo, just a few concepts that differentiates the iLocalBox from other competitive products. We do capture signatures and have a built-in camera to support telepharmacy consultations. Again, we're regulatory compliant. And again, having cool units is one of the major differentiators between us and the competitors. In a future discussion, we'd also like to outline our different purchase and subscription models. So depending on your vision for ROI and what you'd like to do with the iLocalBox, we'd be sure to make a setup, accustomed to your specific operation. With that, I'll go ahead and jump into the system, and we'll start with the association process. So the screen that I'm showing now is the iLocalBox cloud, and I'll log in with my specific email address. Depending on your login requirements for your organization, we can also support various two-factor authentication methods. To start the process, I'll go to Deliver Prescription, and this is where the cloud system integrates directly with your pharmacy software system. And the workflow would begin with a barcode scan generated from a label in your pharmacy software system. Just to simulate that, I'll go ahead and key in an RX number, and you'll see that the interface will pull in my patient-specific information. You can see a list of all the medications that we're looking to stock for this specific patient. We just have one prescription here. And I can also update my email and phone information if I needed to do so. So I'm going to go ahead and key in my cell number and my email. And from here, I can see the map on the right-hand side of my iLocalBox, and I can associate this patient with any cell that's open. You can see the ones that are yellow are associated or assigned with a specific prescription. The blue boxes are cells that are on hold for any given reason. The green are stocked with medications ready for pickup, and then you can also deactivate cells as you see fit. But I'll go ahead and select D9. This is an available cell. You'll see that bin has been updated, and I'll go ahead and press Save. And then the same would go for any additional prescriptions that I'm looking to stock on the iLocalBox. But just for the sake of our demo, we'll just show it with one specific cell here. I'm going to take note of my stock code and my pickup code. Normally you would not need to do this because it's all QR code and barcode driven. But for demo purposes, I'll need my stock code once we go in and stock the medication. All right, so I've got those noted here, and now I'm going to simulate being the employee who's stocking the iLocalBox on whatever given cadence you would see fit for your organization. So I'll jump over to our iLocalBox kiosk system here. So I'm standing at the iLocalBox ready to stock the machine. So I'll tap on the screen to wake up the iLocalBox, and I'll press this secret button here in the corner to sign or scan my employee badge. Because I don't have that, I'll go ahead and just quickly key in my email. And because I'm an employee, the iLocalBox knows that I'm here to stock. So it'll capture a photo of me as the employee to associate with our chain of custody. I'll press stock. And then at that original screen, when I associated the patient with a specific cell, I would have received a a label that I could then bring to the iLocalBox for stocking. So I'll go ahead and simulate that by keying in our stock code, A7YUBE, and our patient prescription information will then be listed out. From here, I'll press load. The actual cell on the iLocalBox will pop open and allow me to place the meds directly into the box. And as soon as I close the box in real time, the patient's going to get a text and an email indicating that they're ready for pickup. So I do have that here on my phone. Not sure if you can see that on that small screen. But just as an example, Here is the initial text message that I'd received, so I could click on this link, see more specific information about the prescriptions that are ready. I could pay on my phone, and then here's the email version of the same message. That could also be branded to your pharmacy operation. This is the QR code that the patient will need to pick up their prescriptions, but again, they could use that stock or the pickup code that I'll key in for our demo. So at this point, I would rinse and repeat. I would scan my next patient stock code, and that next cell would open up, and I could stock the entire iLocalBox. We've seen that the main unit can be stocked in under 5 minutes, so it's a very efficient process. And because it's one-to-one, it's virtually impossible to put the wrong medication in the wrong box. So I've stocked my patient prescription. Our patient's been notified that they're ready for pickup. So I'll go back to the main menu and now simulate a patient pickup. So again, I'll tap on the screen to wake up the iLocalBox. And based on the QR code that I received, I could scan it on the iLocalBox here. Because we're in a demo here, I'll just go ahead and key in my code that I received, 54NA. From here, again, we'll capture a photo of the patient just to make sure that we've got a chain of custody of what's gone on at the iLocalBox. There's 24/7 monitoring using this video camera as well. The iLocalBox is asking me to key in my birthday to verify I'm the correct patient. I'll press confirm. If I paid ahead of time, the iLocalBox would know that in live, real time. If I haven't paid, we'd make sure to collect that before opening up the box. I can collect a signature from our patient and also scan, again, a driver's license for a controlled substance as the state requirements may require. I'll press next, and from this screen, I can opt to do a video consultation with a pharmacist. That could either be somebody staffed at your pharmacy, or if it's after hours, or if you'd prefer to outsource that, you can also partner with a third party to support this functionality as well. Again, entirely optional. You can also plug in a specific phone number if the patient just had to call in for a quick question as well, or they needed additional support. I'm all set with a consultation, so I'll just press Open Locker. And the iLocalBox will display a map of the iLocalBox telling me that my prescriptions are in D9. And on the actual iLocalBox, there's a mechanism that pops the door right open, so it's very easy for the patient to see where their prescription is. They go ahead and grab that prescription, and as soon as they close the door, they also receive a receipt to their email and their phone as well. So if I pull this photo open again, here's the second message that they would receive that has their pickup code and then a link to their receipt as well. In a future live demo, we'd also be eager to show you the various reporting capabilities that we have on the iLocalBox, from continuously monitoring the temperature of the cells to analyzing turnover time and return to stock statistics. A lot of things that we can dive into in a future demo, and also customizing the workflow to meet the needs of your specific organization. Additionally, we can support with helping you with an ROI analysis and comparing the different options with our purchase option and subscription option. And also connecting you with an existing customer or facilitating a site visit would be something that we'd be eager to do in the future. If you have any questions, please don't hesitate to reach out, and we look forward to our continued work with you and your team. Thanks again. Bye-bye.